Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Fabricia Nascimento and Professor Sanjay Mehta join me to speak about phylodynamic inference and HIV transmission. Fabricia, you looked at migration rates. How does that relate to HIV transmission?
So migration rates, they are important for public health because international migrants, they have less access to healthcare and treatment. So if you can identify vulnerable communities in which people living for HIV migrate more, then we can allocate resources to bolster HIV treatment, counseling, and prevention.
Why do you use HIV genome to estimate migration rates?
So when individuals, like it's common that when individuals are tested for HIV and the results are positive, the doctor may ask for sequencing a fragment of the HIV genetic material. So this is done so the doctor can decide on the best combination of treatment for that person. So we carry out a study to understand whether this fragment of the HIV genetic material was enough to estimate migration rates, or whether we would need to sequence the complete HIV genome at greater cost. Our results show that both are able to recover good estimates for migration rates. Our ability to estimate migration rates was driven by having a large enough sample size, although this also points out the need to have methods that can work with big data.
And Sanjay, can you explain what the ethical considerations are with implementing this method?
Sure. Using HIV sequences to study epidemiology has raised concerns among various stakeholder groups. However, most of that concern is centered around the inference of transmission linkages between people or groups of people. While all genetic data is unique to individuals and should be treated carefully, in Dr. Nascimento's analyses, these sequence data are being used to estimate population-level parameters rather than connections between individuals. So the risks to individuals are significantly mitigated.
Thank you both so much for your time today.
Thank you.